Welcome back to the Vet Nurse Confessions podcast, and I would like to apologize that I'm about, weeks and weeks late. I've been busy. I just went to Japan for 2 weeks, heaps of work on, all this random stuff. And yesterday I had surgery. I had a melanoma cut out of my leg and a lymph node cut out. So my leg is so sore right now. So I was like, I'm bedridden. Let's do the podcast. So always working, which is good. But because I've had so much time, I've got so many topics that I want to go through, just random stuff. First of all, Japan, beautiful, and you should definitely go there. We went skiing, I loved it. I thought of this, we were at this deer park, right? And the deers, the signs everywhere saying they buck you, they kick you, they bite you, and I was like, oh my god, these animals are crazy. And we went in and I got bit on the bum by one, and I was screaming and running around there, and my partner was like, it's like you've never worked with animals before. I'm like, no, I think what it is just that I've seen what animals are capable of. So you're more I'm more nervous because I know that animals can be nuts, and I think that is a vet nursing thing. Before I was vet nursing, I would be I love animals that are, really confident. But now I'm like, animals can be absolutely insane. The stuff cats can do, they're scary. They can be scary. But so funny, I was at this park, and you as vet nurses, we notice these things that probably everyone just thinks is normal. The baby one that's limping around, it looked like it had a spinal issue. Another one's chewing this chain, and then they just walk across the road in the middle. There's cars going past probably 60 k's an hour, and then they had to kind of stop to let these deers, and they just walk out of nowhere. I'm like, how many deers get hit by cars here? But to everyone else, they're just oh, this is cool. But obviously we just look for the hazards, which is just typical. I thought that was really funny. But yeah, no, it was really, really nice. I love Japan and I can't wait to go back. And I tried to have an actual break from kind of socials and stuff whilst we were gone, which was really, really nice. But what's been going on exactly? So I actually have heaps of topics. So let's get started. And I've got questions that you guys have asked first as well. So let's just start off with that. So the first one was, how in vet clinics, say you're new to nursing, how do you find out what you're passionate about? Which I think is a really, really good question, because I find that once you find your passion in the clinic, that's when you kind of start to really enjoy yourself. So what I would do is try and get into different not different avenues, but different aspects of your clinic or your hospital, or seek clinics where you can get that exposure. For example, if you're in a GP and you've been there for a few years and you kind of know it back to front, I would probably look at going and doing maybe a couple of shifts at an emergency clinic. The experience and the stuff that you learn in an emergency clinic in such a small amount of time is crazy. You just get exposed to so much. You learn different techniques and ways that vets and vet nurses do things, which then opens your mind up as well. When you're at one clinic for a long time, you kind of learn and kind of have in your head that, oh, this is the way that it's done. And when I say when it's done, I mean catheters, bloods, prepping for surgeries, recovery, all that kind of stuff. I know you learn in TAFE or when you're doing your course that this is the textbook way, but to be honest, it's rarely ever done textbook way. It's done in clinics to suit the clinic, the patients, the clients, to suit that clinic's particular needs. So these things might vary slightly. What I'm saying is they might use different tape. Some hospitals might use gloves for certain things. Some hospitals, that kind of just little variances that you'll learn. So you'll go into another clinic, but oh, okay, so they do it this way. And instead of being that's the wrong way to do it, that's not right, that's not textbook, that's a very bad attitude to have. Never, ever, ever have that attitude towards clinics or to staff. You should always have just an open mind. Okay, that's interesting. You do it that way. That's cool. It's always about just learning different kind of aspects. If it works for them, totally fine. If it's not harming a patient, it's just that their way, their technique, their protocol that they have installed in that clinic. But yeah, I did a stint in an emergency years ago now, but I did 3 months, I think, and I just did weekends because I was working full-time as well. I ended up having to stop because I physically couldn't do it. I would work on a Friday in GP till 6. I'd drive down to the emergency and work from 7 till 7 a.m. And it was just in a time when I just wanted to save extra money, and it's really good. It is really good money. And I was just living on my own. I didn't have any pets at the time, so it was great. And it was really good because I learned so many new things. And I think that was like the first time I was exposed to like that vets work for, sometimes they work for commission, like commission based. Because I remember one of the vets saying to another vet, oh, if you do the consultation billing, I'll do the surgery, we'll split the, and I was like, oh, I've never worked in that. I found that really interesting. And but what I found in that hospital was, yeah, just heaps of different like techniques that they did, and just kind of protocols, which was cool. Like it opens you up to stuff, and then it teaches you as well, okay, I love emergency, or maybe emergency is not for me. And then you can kind of go back to GP. You could look at doing work in a specialist. So like doing like, you could be in like a cardiac ward, or like a dentistry, like veterinary dentistry. I personally love dogs' teeth. I love teeth. So dentistry sounds like amazing to me. That is like a very, very, like, that is high on my passions for pets, and even teaching pet owners about teeth and how important it is. That's one of my passions, kind of thing. But I would only have learned that because I was doing scale and polishes, you know, that kind of thing in clinic. So if you're not getting hands in there, trying every aspect in the clinic, as long as you are, you will definitely pick up stuff over the time and be like, oh, I love being in consult, or I love being in surgery, or I love being on reception, or I love running puppy school. But you won't know that until you do it, kind of thing. So I think it just comes with an experience thing, and just putting yourself out there. Definitely putting yourself out there. Next question. Okay, how to deal with emergency cases. So emergency cases, like, you can never, the first one that you'll have in is like, you can never kind of prepare for it. It's always like hits you in the face, you know, like, oh my god. So say, let's set the scene here. You're on the treatment area and you've got reception, run out with this dog in their arms, limp. Put it on the treatment table, go, this, you know, it's been hit by a car, or it's, you know, something tragic. And you just go, oh my god, what do I do? Obviously, whilst you're still training, there'll be other people around that can jump in. Whilst they're jumping in, what you need to do is listen. Listen to what they're doing. Listen, if they say, I need this, grab it. You know, just always be over prepared for it. But don't think that in that situation you'll ever be prepared for that first one, the first, second, the third one. It's always like a shock to the system. And you'll pick up over time that you'll learn this, and it just comes with experience as well. You'll kind of get used to just sifting through the emotion that it's a tragedy that's happening right now, but you need to think straight, and what do we do to get through this? And that is like one of the like amazing strengths that vet nurses have. They can kind of just see exactly, okay, this has happened, I need to do this, let's fix this, let's help this pet. And I'd like admire anyone in an emergency situation who can just kind of get in there and just, it's amazing work. And it's, you know, not for everyone, but that's something that it'll come with time. But yeah, I would always say, and I've seen this before, you know, there'll be a crash bench and we'll be doing CPR, and the juniors will kind of hover away and kind of leave. No one expects you to jump in or, you know, do anything like that, but your body is there as a support. If I said, I need a bag of saline, I need a towel, they're not kind of run off and hidden. That is the best thing that you can do. So don't run off and hide in the laundry kind of thing. Because it'll be a big learning experience for you as well. I had this random thought the other day about a client that once called me a bastard, and I was like, that's so funny. Like, you get to like meet so many clients over time that are just crazy. And you know, lots of people think that you get into this industry because you just love animals and you don't want to work with people. Trust me, I get it. That's me. But you kind of learn to deal with people, and what you kind of find common ground is that you all love animals. You know, that's your common ground. That's where you can kind of connect with these people. This lady, she was funny, she was weird, and she would always say, you know, like just random stuff. But one day she brought us in a packet of chocolates, and then the next day she came and she goes, I had all them chocolates in your test, you bastard. And I'll never forget how, like, but she was funny, like it was hilarious. But I was like, let's say like, it meant me saying that back to someone is just so weird. But I think as well as like vet nurses, we're kind of naturally very sensitive beings. We're sensitive and we're very kind of take things to heart because we care, right? And it can be a massive positive, but it also can be a flaw as well. It's finding like that common ground where, say if a client does upset you, not taking it to heart, you know, and they will, you know. I was talking at work, we were talking to work the other day, like about, you know, people complaining about prices of vet clinics, and yeah, I totally get it. But in lots of clinics, that those prices aren't made up by your receptionist, your vet nurse, your 20-year-old vet nurse that's on reception. She didn't come up with those prices. You know, someone in the, you know, from above has, and then, but it's that receptionist that does cop that, you know, abuse, or why, so, you know, they're going off and they're being rude. It's always really important just to remember that they're not angry at you. It's not aimed at you. It's, if you think about it, he's there, say client is getting angry about a price. Who else is he going to, you know, go off about it? You're there. Unfortunately, you just become kind of the punchy bag. Do I think it's acceptable? Absolutely not. But he's trying to vent somehow. You know, if that business owner that's made was there, he would probably say it to that person. But at the time, you're kind of that funnel to that. So the best thing to do in that situation, if you do have a disgruntled customer, is to say, oh, I can hear what you're saying. Do you want me to get my manager to get in contact with you? Do you want me to go and get my manager? I'm just trying to help at this stage. I totally understand what you're saying. We can definitely work something out. Always really important as well when it's in regards to financials, discussing payment plan type things, because a lot of places, a lot of clients don't realize that that's a thing in the vet world. I've realized that they don't kind of, people go, oh, okay, and so they just think they've got to pay this. But no, there are different payment plans. Even having it on your counter so it is, you know, viewable to them that is an option is a really good idea. But always just remember, like, don't take it to heart too much, and just remember, like, it is there, you know, that person is having a bad day, that person has been, you know, caught with this big bill that they didn't expect it, you know, it's just, it's life. Unfortunately, they've taken it out on you, which is totally unfair. But just remember that they're not angry with you, they're angry with the situation, kind of thing. And as long as you don't arc up, I always find that you get back what you put out, kind of thing, on reception. So if someone comes in and they get, and you don't acknowledge them or something like that, that puts a bad taste in their mouth to start off with. So if my biggest thing when people walk into the vet clinic is acknowledge them straight away. If you're talking with a fellow staff member, you cut that right away. Hey, how you going? And then they're going to be, okay, really receptive to you. If you ignore a customer that walks in, it is the worst thing that you can do, especially just from the get-go with this client, starting off with you just ignored them. If I walked into a vet clinic and someone ignored me, I'd just be like, are you serious? Like, you know, when you go into a shop and you're buying clothes and the retail, you know, assistant just ignores you and you're like, what the hell? I think it's like the rudest thing. I'm huge, because if you are happy, bright, hey, how you going, from the get-go, you start on a positive note with them. And also, say if they go in and they come back out and they're angry about the price, or they're, you know, it's, if you've set up that relationship from the start as a positive, hey, how you going, da, 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 they're very like, it's unlikely that they're going to come out to you again and, you know, flare up at you, because you've set that, you know, you're a down-to-earth person, you're nice, you're friendly. It's about what you put out is really just as important. So just keep that in mind if you're having trouble with clients, because I know I was the same at the start. I was like, oh my god, they're so mean, they're being so mean to me. I remember this lady, it was like a Saturday, and a stray dog had come in, and like, we closed at 12 on a Saturday, and we're like, okay, we've got to send this dog to the local pound because, you know, it needs shelter over the weekend, someone to feed it. and I called the pound, got it sent over, and then on the Monday morning, the owner came into the clinic. She's, hey, I've lost my dog. I'm like, oh, she came in on Saturday. She's been transferred to the pound just locally. Oh, you silly girl, she called me, and I was like, what? Oh, you silly girl, she said, and she walked out, and I was like, so like unjustified, because like, what would you have rather us do? Just push the dog out the door and just, oh, you'll be right over the weekend? And it wasn't that she was angry at me, it was just that she was angry she was going to have to go down to the pound and pay to get the dog out. That's not my fault. We did the best thing that you could do for that dog. Like, what was I going to do, lock it in the clinic over the weekend? No food, no one looking up. It just, people are strange, but don't take it to heart. Do you know what I mean? Like, don't people are weird, people are always going to be weird. Try and put out the best that you can. You will get positive feedback back in regard to that. And don't kind of dwell on anything too much. You know, pet owners don't really understand a lot of the stuff that we do because we've been doing it for so long. So there's a lot that they just generally don't know. And the first thing that they do is project an angry kind of attitude towards this stuff. But if you kind of said, you know, discuss with them and explain thoroughly, that you kind of see it kind of ticking it, oh, okay, like in regards to price or in regards to medications, all that kind of thing. Once they know, it kind of all ticks and, okay, this makes a lot more sense to me now. A positive in regards to dealing with clients is I found over the years, and people always kind of are like, oh, why didn't they? So say a client goes in with a vet, they have a full consult, they've got a diagnosis, they've come out with all these meds to reception, and they go to the reception or the vet nurse on reception, hey, so like, what's wrong with my dog? Or what are these medications for? And you're kind of like, didn't the vet just go through all of it with you? This is kind of a compliment to vet nurses, because what generally happens is vets are a little bit intimidating to junior nurses, to clients. They're this extremely smart person, right? That usually talks in all these huge words that no one understands, clinical words, and people just go, oh, yeah, I get it. Then they come out to you on reception, someone that's a little bit more, maybe a little bit more down to earth, a little bit more relatable for them. And lots of the time I find that it's like a maternal thing. Like, if you're a younger like type of person, they'll come out and just want to kind of like discuss and relate with you. And a lot of the time it's just that they can feel like they can talk to you, which is like the nicest thing. So they come out and they ask, oh, do you know, because what it is that they want you to explain it to them in layman's terms, which is the best. And you just literally say a dog gets diagnosed with otitis externa, and the vet goes, here's some Demotic, use this twice a day. So they come out to the desk and, oh, what's the dog? And you, as long as your vet is okay with you explaining it and you kind of know what's going on, you can say, oh, he's got a nasty ear infection, just a yeasty kind of ear infection. We'll use the drops for, you know, as long as the vet has kind of said it's all on the label there, and it should clear up. You know, just kind of not dumbing it down, but just kind of making it easier for them to understand, so they don't go home and Google it. Just talk to them in layman's terms. It makes everything, makes that community. And so then you're building that relationship with that client as well. So when they come back in, they'll want to have a chat to you. They can kind of talk to you a lot more. Also, that the vets are kind of flat out, so they can't kind of be going explaining a lot of something. But that is where vets, I find, vets versus vet nurses kind of relate to clients a little bit more, which can work in our favor. What else have we got in here? There's a new cat clinic opening on the Gold Coast, which is amazing. There's like a bunch of them in Brisbane. I saw that they were hiring for a nurse, which is really cool. So if you're on the Gold Coast and you love cats, go and work there. I've seen the clinic, it looks beautiful. So I just thought I would just throw that in there for you guys. It's pretty cool. Is anyone going to the VSS conference? Because I am. With Vet One in March. It's like the 16th and 17th, I think. So I'll be there. So if you see me, come and say, hey, come and chat. I love that. So I'm excited for that. And then I've actually been invited to Vet Expo in October. And that is for vet nurse school, which I'm really excited about. So I'll be there. Come and say hello. I'll be in my pink scrubs. I'll be like this. That'll be cool. I don't know what else is going on. What else is everybody doing? But another thing I wanted to talk about was, I do get asked a lot about working in the UK versus working in Oz, like going back and forth, how to do it all. The best thing that you can do is get in contact with like a locum agency called like GVC, Global Veterinary Careers. I'll put a link below for them, but they kind of take care of everything for you. Working in the UK versus Oz is very similar. It's all very much the only kind of differences would be like medications. The active is the same, but they're like active is the same, but the brand names are sometimes a little bit different. And then the preventatives, they're kind of the same. They might be a little bit different, like covering different parasites. Like here in Australia we've got like lots of paralysis ticks, so we push for that a lot, but some of them are much the same, just different names. Like Revolution is called Stronghold. Revolution in Australia is called Stronghold in the UK. And then a couple like dog breeds. I found like heaps of different dog breeds in the UK versus versus Oz. What else? If you need a visa or a passport, so I had a British passport, so I could work over there fine. You might need a visa, working visa. I think they're pretty easy to kind of obtain between the UK and Oz, which is really good. What else? Accommodation. In Australia, you're probably going to have to set up like a long-term Airbnb. In the UK, lots of the clinics have little flats above them, which is so handy and so cute. I love them. But if they don't, you could set up an Airbnb in the UK as well. What else? And location, I guess. I would maybe, if you're going for the first time, I would maybe do like quite central to London. I did one in South London, and then I did one in like West London, in like, I think it's West. That's probably right, in Notting Hill, and it was like my dream clinic ever. Loved it. So they were both like right in the heart of London, which I love, because you just get on the tube, get on the train, go anywhere. So maybe for your first time, I would start off with that. You don't have to also go for 6 months or a year either. Like you don't have to sign up for a long time. The good thing with GVC is they've often got different kind of time frames that clinics need you for. So you might go for a 2-week stint or like a 4-week stint, which for your first time, I think is really, really good. Like I think the max I've done is like 3 weeks at a time. And it just kind of gives you just enough time to kind of settle in, and you're still just kind of loving it. I love it. If I didn't have like a partner now, I would go back and do longer. If I didn't have a dog, I would probably move to the UK. I don't know why, I just loved it. I loved it so much. But if it's something that you're looking at doing, I would 100% look into it and just kind of commit. Whilst you're young, just do it. Another thing that I want to talk about, that I'm getting lots of messages about lately, is I went on a trip last year, and I started in Nepal and India. And when I was in Nepal, I went to like a wildlife sanctuary called Chitwan National Park, and it's like this animal refuge clinic center, and it's huge, and they like rehabilitate like rhinos, elephants, crocodiles, heaps and heaps, and it's a really beautiful place. And so I went and visited that through a Intrepid travel tour, and we had like 2 days there throughout, and I just had lots of messages about that. And I think if you are traveling, and I travel solo most of the time, I love it. I think if you are thinking about doing that kind of trip, it was the best thing. Like this trip went from Nepal through to India, and it was about 2 weeks, I think, and it was beautiful. Like I would highly recommend doing something like that. I had a girl message me recently, actually. So when I was over there was this baby rhino that had just been kind of it was being cared for, and it was really little. And she messaged me, so this was like May last year. She messaged me like last week, sending me photos of the same rhino, because she's there right now, saying he's a year old now and he's doing really well. And she sent me these photos, and he's all big, and it was just like so cute. And she was there doing like not a traineeship, like a what are they called, like an intern, not an internship, something similar to that. And I was like, that is so cool. So it's called Chitwan National Park. So if you want to do something like that, travel and work with animals, oh, I just love it. I knew a girl that I worked with who went and did one in Africa and did all like the wild cats and wild animals, you know. Awesome. She loved that experience, I remember. If you're thinking about doing one of those, do one of those. I think the most important thing vet nursing is taking breaks. I've always taken like a month off a year, like a chunk a month and gone and done a big trip, because I always find that, you know, you get a little bit burnout, a bit strung out if you're working long days for so long that you don't take a break. And then when you take like a month off, you actually have time, because I was always like in like a management type role in my clinic, and all I thought about was what's going on in the clinic, you know, staff, what's, you know, protocol, how can we make this better, it was all I thought about. I was so engulfed in it. So when I would go on these trips, it actually gave me time to disconnect and not think about the clinic at all. Like, I feel like if you take a week off, it's not enough time to kind of really separate the two. And so if I would take a month, it would be so good for me. And I always found going and working in other clinics while I was away as well, I would come back with new ideas. Hey, this clinic did this that I thought was super efficient, they did this, like, and incorporate those things that I found that you learn in other clinics back into my normal clinic, which was cool and it was amazing. And, you know, that's what it's all about, really. But I think that disconnect, I would always come back and be in like a really good motivated mind frame to kind of get back into it, and I would have like the pep in my step would be back to kind of get back into it and, you know, get moving and get the clinic running like well and smooth and happy place for everyone. Okay, I found more questions, which is really good. So one is where to start at age 21. So if you're, say you're 21 years old, you've got a little bit of work experience under your belt, I would definitely if you're working a regular job, keep that job. I would go and try and do like a day work experience in a clinic, and I would look at getting enrolled into a vet nursing course. Second question is, can you do vet nursing online? Which you definitely can. For me, I'm a very hands-on person, so when I was doing my study, I did struggle a little bit, and I did kind of keep extending paying extra kind of fees to kind of push it out, only because I was working in the clinic full-time, which benefited me, but it just meant that I was struggling to get the theory done. You can study online with like a facility called Australian College of Vet Nursing. They offer it completely online, so via correspondence instead of going into a classroom. If you are wanting to study in a classroom, you can go through a facility like TAFE, and you kind of get days that you go into a classroom, sit down with a teacher, go through everything. You also will have like clinical days with them where, so you're in your clinic that you've got your placement, and your teacher will come in and monitor you and kind of sign you off, which I think is really, really cool. And I think it kind of gives you experience to be able to, you know, hey, ask questions and kind of get feedback, which I think is really nice. Next question is, what was my experience with Australian College of Vet Nursing? Because that's who I studied with, and it was really great. You know, their support system was really good. Having that ability to extend it, I'm not sure if you can still do it like that anymore, but for me back then it did. That was the only way I was going to be able to finish the course, is if I just got a little bit more time. I did prefer to do it online so I could work full-time. Keeping in mind, I was working full-time. I actually had 2 other jobs. I worked at Boost Juice and I worked at Sunglass Hut for an amount of time. I just liked working a lot. I liked earning money, and I also went on a bunch of holidays throughout that time as well, like big trips, you know, to like the US and things like that, which I just love. That's just what I like doing. So instead of just kind of like hustling down and studying, I needed those breaks. That's what makes me work better, kind of thing. What else have we got? How to deal with bitchiness and cattiness in clinic. I'm struggling. It's a hard one. It's a hard one. Do you know what? If there's one bad egg, it's often what sets it off. You can just kind of be the mature person, always be the better person, be mature, always be better, never bitter, kind of thing. If you just kind of rise above and just, you know, don't put your time into it, those people say, if they're, you know, bitching about you or getting catty with you, just don't give them the time of day. Just go in there, do your job, try and just kind of stick to yourself for a little while. If that doesn't kind of separate you from that cattiness, and I know sometimes it can. Being in clinics, it's mostly a female workplace. Maybe have a chat to your management about it. Say, like, this is a real issue, this is affecting, and at the end of the day, it's their issue, not yours. And it sucks because I know that, like, you just want to go into your job and just kind of love the day and like have fun and just kind of enjoy your work and like hang out with animals and just kind of, that's not why you go to work kind of thing. And it can ruin it, and it can have, you know, you go home and you're just thinking about it, and that's awful. Like that's not what you want, and that's not why people get into the industry, and that's not what, you don't need it. So if it does get quite bad, I would maybe look at going to another clinic, because lots of clinics aren't like that at all. Like I've gone into so many clinics and it's just this harmonious, like great team, and you're just like, oh, this is so good. Like when I was managing at my last clinic, I think I had about 15 nurses at the time, maybe a little less, and every day all I did was sift through, hey, this girl said this girl said this, and it was like, come on, it drove me nuts. So now in my job where I'm not really around that, I love it. It does get quite draining. It comes down to a maturity thing more than anything, which sucks, but I think definitely if it doesn't get better, move clinics, because there are clinics out there which are great teams. There's none of that. It's kind of, you'll find a vet clinic where all the people that have tried to get away from that stuff have all kind of come and like joined that, which is like the heavens. That's what you want. That's what you want to find. That's what you want to get to. Triage. Someone just wrote triage exclamation mark. And triage is hard. Triage is something that like it comes with overtime, and like doesn't matter. Like you can read a textbook about it over and over again, and it's still, actually you can't even really write it in a textbook. All you need to remember is, if you think about it, if a patient is in, you know, dire need, say they're actively bleeding, they've got, you know, a broken leg, they're, you know, unconscious, they are unresponsive, unconscious, seizures, all of those things that kind of, if you were to leave it, would be fatal, need to be seen now. If you get any kind of conversation like that on the phone, it's come straight down. Triaging in the waiting room is a little bit different. Say if you're in an emergency and you're kind of triaging through things that can wait a little bit longer, say things that need to come through are like seizures, fainting, active bleeding, what else? There's heaps. Because I actually struggled with this as well, and lots of my nurses that worked for me did struggle with this, and they would pick it up over time with experience. I actually put all of the really kind of vital things and set examples for you, because if I sat here and went through it all, it would just kind of go in one ear out the other. I made a triage guide, and it's on Vet Nurse School now, and it kind of goes through examples of phone calls, what you would do, and kind of goes through what's important, what's not, where you can kind of end, which I think is the most common thing that people struggle with is with triage, is how to explain triage to the client, and how to explain that their patient is important to us, but we've got this emergency first, that kind of thing. If you kind of can word a conversation around that, you're laughing. Like that whole triage issue, that complication around triage is kind of made a lot clearer. So go and check the triage guide out. The triage guide has probably been one of my most popular guides, because nurses really struggle with it. It is really, really hard. I've had heaps and heaps of vet clinics buy that guide, so it's being used in clinics to help their nurses. So I think it's really, really helpful. And it's just got all the most important stuff about triage, not all the fluff, you know, that you don't need. It's just all the kind of vital stuff to make sure that you understand triage and that you can triage confidently more than anything. Thank you for listening. I'm out of breath. I need to go and have a drink or a latte or a mimosa or something. But I promise I will try and make another episode soon. Drop the comments in, drop the questions and all that in the comments below, and I'll speak to you soon. Oh, also before I go, I just released my new pet accessory collection, baby pets. So that is just live, and if it's still Valentine's Day when I post this, it's 20% off at the moment. Use code Valentine's Day, and it's the first sale that I've done on this collection so far. So and I've got limited numbers, so just be quick. If you need help with sizing, just message me. But they're so adorable. This color palette is like, I'm obsessed with it. But yeah, they're selling out, so just be really, really quick. I'll speak to you soon. Bye.